benefits, there is no definitive cure for PTSD. But what if we could heal the part of the brain that's traumatized? Solutionaries producer Katrina Scales found a Florida doctor using pressurized oxygen to grow new cells with amazing results.
Imagine you're diving deep down into the ocean. You feel pressure building up in your ears, then you hear a pop, and your ears equalize. It's an essential skill for any scuba diver, or else they could get decompression sickness or the bends, a potentially deadly scenario. And there's only one way to treat it: hyperbaric oxygen. But it turns out this concentrated pressurized oxygen may have benefits that go far beyond curing divers and pilots from the bends. Clinical researchers have discovered just in the last few years that putting someone in a hyperbaric oxygen chamber can actually heal traumatic brain injuries by regrowing stem cells. In fact, it's now being used to treat things like skin infections, long COVID, and even post-traumatic stress disorder. Here's a veteran talking about how hyperbaric oxygen therapy changed her life.
After 13 years of combat, I was told it was PMS. We moved to the villages and there was an ad in the paper one day for Aviv taking veterans. They had here said, "Look, it is in your head." And so it wasn't PMS. All the tools the doctors had couldn't fix this. All the pills that they gave me couldn't fix this. But oxygen under pressure did.
It almost seemed too good to be true. So I found the doctor in the villages providing this therapy. His name is Dr. Mohammed Elamir, or Dr. Mo.
I'm one of the lead physicians here at the Aviv clinics here in Central Florida.
Hyperbaric oxygen therapy has been around for hundreds of years, but he told me Aviv Clinics does it differently.
Most hyperbaric chambers are mono chambers, single occupant and lying down in a horizontal tube. The other type of hyperbaric is a multi-place chamber, and that is basically like walking in a large airline cabin where you can walk in. I'm 6'3" and I have plenty of headroom. The chairs are nice and wide, almost like a first-class seat. And our multi-place chambers can hold up to 14 people inside each one, and we have 4 of those in our clinic.
Yeah, it almost looks like you're sitting in like a waiting room at a doctor's office, but everyone just happens to be wearing masks. So explain to me, what does this pressurized oxygen do to the brain?
What hyperbaric oxygen does is delivers 100% oxygen at a higher concentration to different parts of the brain. So when you go inside a hyperbaric chamber, you can now deliver oxygen more efficiently and at a higher amount to help heal those cells. What we also do specifically with our treatment is we fluctuate these oxygen levels, and that fluctuation addresses those other 2 components of brain injury. In 2019, the Nobel Prize was awarded for a molecule that gets released with this fluctuation protocol, and this molecule stimulates new cell growth. We were taught in medical school that you couldn't grow new cells in the brain, but that's not true. You actually can, and we have ways to show you and prove it, as well as actually do it.
For Dr. Mo, this medical breakthrough is personal. His late father, neurologist Dr. Magdi Elamir, suffered a stroke, robbing him of his speech.
Watching that process, losing the ability to communicate is a devastating thing. It's almost, some would argue, worse than losing function of a limb.
It sent Dr. Mo down a path in search of other ways to help people like his dad.
Eventually, that led us to finding Dr. Shai Efrati's research and joining the team here to use hyperbaric oxygen to actually heal the injured cells of the brain. Unfortunately, he passed before I could get him through the treatment, but his experience led me to the research and led me to joining the team here. So we've had stroke patients coming in wheelchairs and being able to walk with a cane, people regaining function of their limbs, people getting part of their speech back. And it's all about healing that tissue and growing new cells around it.
So what does the research say about the effectiveness for treating PTSD?
When we used to say PTSD, it was always just thought of as a psychological disease after trauma. But in fact, PTSD and trauma from anything, not just war, causes changes to the brain. there are different physiologic changes metabolically and structurally in the brain that happens as a result of that trauma. And that trauma doesn't have to be a physical blow to the head. It could be just witnessing something traumatic. And that over time changes the brain. And if you identify that injured tissue in the brain and you heal it, you are now treating the cause of somebody's PTSD. You're not just giving a medication for a symptom. When we had our veterans come through, they went through our assessment and we saw in our specialized scans the destruction and changes in different parts of their brain. We got them through the hyperbaric treatment, healed that wound in the brain, and that led it to the improvement of their PTSD to the point where most of them no longer met the criteria for PTSD after they finished the program.
Okay, so it sounds straightforward and promising, but is this a solution for everyone? First, what are the limitations of hyperbaric oxygen therapy?
Our assessment before somebody starts treatment is essential. Some conditions right off the bat that might disqualify somebody from going in. If you've had a collapsing of your lung, that can be a problem in a high pressure situation. There is a lot of research with cancer and using hyperbarics for cancer treatment, but right now, if you have an active solid tumor or solid cancer in your body, the last thing we want to do is grow new cells and new blood vessels into that cancer to help it grow. So that might prevent somebody from doing the treatment. One important thing, if you're a scuba diver, you know, when you dive, you have to equalize and pop your ears. Well, you actually go for a dive whenever you go into a hyperbaric chamber. And as we build the pressure up, you have to be able to equalize your ears. And if you can't, or if you have some structural issue with the ears, that might prevent you from doing the treatment.
Second, healthcare is expensive. Who can afford this kind of treatment?
Like every new treatment, at the beginning, it's going to be costly to a point. But we have different programs. We're working with different organizations, like you mentioned, the American Mighty Warriors, to help our veterans. And we have our own Aviv Cares program for people that can't quite meet some of the financial requirements. They can actually get the treatment for a reduced cost.
So far, the Food and Drug Administration has only approved hyperbaric oxygen therapy for certain conditions. So it's important to talk to your healthcare provider before undergoing any treatment.
The philosophy here is we're treating the causes of people's conditions. We're not just giving a medication or putting a Band-Aid on it. And if you address the cause, if you address prevention, that is the best thing you can do for yourself.